important is these arcs and the distance between these two arcs. This is proprietary. The distance between these two arcs, this is proprietary, and the way this is constructed. So this does not allow anything to pass through except exosome. So all types of pyrogens. What is pyrogen? Pyrogen is dead body of bacteria and virus. Correct? When you say, okay, I want this room to be sterile, I can sterilize it. I can put ethylene oxide or formalin, it will become sterile. But everything will be dead here, right? So the dead bodies will still be there. So the dead body of bacteria and virus is called pyrogen. Now sometimes you see a drip. Even with normal saline, the person starts to get shivering. And you wonder what is happening. We tell, no, this is fever. So these dead bodies also cause that shivering. So everything has to be filtered out. So with this double filter, all this comes out. You can go to the next slide. And then you can inject. So you see with PRP, when you see under the microscope, you see the platelets. Okay? And the exosome, we don't see anything in the microscope. So if you want to check whatever you take out, you put a drop, you stain it, and you see. If it is exosome, you will see something like this. If it is PRP, you will see some. This is just to make sure it is exosome and not PRP, because the procedure looks the same. People will say, oh, this is another gimmick. He's just selling another PRP kit or something. So we will make sure, okay, this is the exosome, this is the PRP kit. Okay. Next slide, please. Yeah, so these are some clinical examples. I just show the pictures if it's okay, or let it be. Okay, show. Okay. So you see, this is a hypertrophic scar. This is a before and after. Okay, next slide. This is your diabetic. So in 20 sessions, with dia 0 and exosome, so we got this good result. Next slide. Another diabetic foot. You see, we get this good result. Next slide. Yeah, this is a leukoderma, very difficult to treat. I'm a dermatologist. As a dermatologist, people come, once it starts, it's very difficult. So with the exosome, we inject locally, and it's totally gone from this lady. Next slide. Yeah, this is again for beauty. Those who are interested in beauty can put it, in the skin instead of using rose exosome. And it sounds very nice, but I don't know how rose petals don't come. Next slide. This is for the neck wrinkles. Yeah, next slide. Yeah, for the breast. So along with the fat, those who are doing, you can do in the breast lift. Next slide. Yeah, again, next slide. You can see under eyes, the patient. Next slide. Again, you see these tear troughs are corrected. Next slide. You can see these fine lines and wrinkles. It's all gone here. Next slide. Yeah, this is a full face done. Yeah, next slide. Yeah, so this was my patient who came with, he had totally lost alopecia totalis. All this was not there. I did not take the picture at that time. So he had no hair on the entire body. This was not there, nothing was there. So what we did is that we give him exosome. Now see, you cannot inject the entire scalp here. He had no eyelashes, nothing. This was the second or third sitting when I took the picture, because first time he was my maid's son. So the first time he came, I thought that nothing he'll get. So then he went to the village, and this is his picture after that. He sent from the mobile selfie. So next slide. It took around 6 months. So this is, yeah, next slide. Yeah, stretch marks. Okay, this took 1 year. Okay. Next slide. So even for the males, for the penis, we will inject sometime. For the ED, they're getting a good result. You can put in the next slide. Yeah, this is before, after. Next slide. Yeah, for the vaginal tightening, many of the females who want it, for the cosmetic gynecologist, I think some are there. We can do it along. Yeah, thank you. Thank you, Dr. Radha.
I got 1-2 questions to ask you. Okay,
Yeah.
This is real experience. Dr. Edwin, can you come up, please? If you are invited on the stage, it's a privilege. That means I recognize your skills. Please come.
Thank you, sir.
Okay, hold on. You tell them about the breast cancer stage 4. Hold, come this second. Stage 4, that you saw one of the patients with a sweeper, remember? She has stage 4 cancer, breast cancer.
In our clinic.
Yeah. You gave RK0 and RK dia 0.
Yes, yes.
Okay,
Yeah.
listen very carefully.
So there was this one poor lady who had come to us, with the breast cancer stage 4, and she was maybe 28 or 30 years old, and they wanted to do bilateral mastectomy, but she had no money to do bilateral mastectomy, because see, even for that stage you need money. She used to work as a cleaner, and her family also was a cleaner, so they have no money. So they came to us, okay, doctor, do something, we don't have money, we can't afford anything, we can't even afford medicine, forget, and they don't have insurance, nothing. And they did not have any papers and all these things. So I said, okay, you just take this medicine and you go. So I gave her 0 advanced care, because that time we were trying that. So I had some good amount of samples. I said, okay, you take this and have this twice or thrice in a day.
Dia 0.
And dia 0 also.
And dia 0, huh?
And dia 0. And then she was losing weight, becoming cachexic, all these, the typical signs. Breast was discharging, and pearly orange appearance, all those things were there. So the whole hand was paining also. And she was a young girl, 28, 30 years old. So she took it for around 6 months to 8 months. She could not afford any other therapy. And gradually, the discharge stopped. Gradually, the mass started to come down. Today, the mass is like maybe 1/4. There is no discharge. And we also are trying exosome therapy IV for her. So she's doing well. So I'm not saying this is, conclusive, but this is definitely helped for her. It's 100% cure. For other people, as a doctor,
Okay, at least
wouldn't look
we
at
have
it.
the first evidence. That's what we want to hear from there. Even RK0, when he was trying the 3 cases, I said it was a fake. It was chance, maybe, fluke. First one fluke, second one fluke, third one fluke. The fourth one was maybe, fifth one maybe. The 6th time was when I had the conference. 115 doctors came. Dr. Lenny, yeah, she was one of the persons who were taken. 9 doctors. We sold out 1,666 boxes in 1 hour. You know, doctor, are you listening? This alone will make you $1 million. Are you listening? Okay, I'm very choleric. I've learned because to take on a market. So I want you to listen, because you are the healers, right? He's my guru. We learn to adjust with each other, because both of us have got different sets of mind. But he was the first guru of mine. He's the one I learned the PRP and everything else, how to do. And he's going to lead the Malaysian team. You're going to duplicate to him. He's the guru. He's the person who's going to lead the nation into this, because he has been having this specific aesthetic clinic, and he's been doing stem cell, SVF, Botox, facelift, hair transfer, hair growth, all the range. So I will take a person like this who is a teacher, who's a trainer, and train the rest of us. So he will be coming back on a later period, because we need to register through Dr. Janira, and he too will register, but he'll train doctors, okay? Because he's got the experience in that. So we will develop many more trainers. He's not the only trainer. He'll train the trainer program, because it's about duplication talk, okay? So I recognize your skill. So we're going to train a lot. Doctor, you don't have to do protests on MMA. We're teaching the skills. 1 million a year. So when we are having a master class, he'll be coming and training too. He's a duplicate, so when he reverse, we'll develop a lot of them. And come on, beauty industry is huge. Am I right, Doc?
Yes, sir.
Thank you for coming in. Thank you so much.
Thank you so much.
Okay, before you go, Doc.
Yep.
Okay, I have violated